marks the beginning of Women's Lung Health Week. It's time to reflect on why paying close attention to your lung health and diagnosing and treating lung disease is so important.
So very important. Here to start that conversation is cardiovascular and thoracic surgeon Dr. Timothy Hamilton, who just returned back to Vegas.
We missed you.
Yes. Also along with us is Women's Oncology Coordinator Michelle Big. Welcome to you both.
Hi.
Hi. Great to have you here from Sunrise. Let's talk about lung cancer. There are a lot of misnomers when it comes to how much it affects women.
That's true. Women are affected by lung cancer equally as men. It's been underdiagnosed, it's been underreported, it's been underpursued for a long time, but it turns out lung cancer is the biggest cancer killer of women, bigger than breast cancer and colon cancer combined.
Wow.
Isn't that mind-boggling?
And you barely ever hear about lung cancer more than per se, say a breast cancer awareness. This is why this week is so important.
It is.
Wow.
Worth noting, by the way, I think people just all have in the back of their mind, well, I don't smoke, so I'm not getting lung cancer. Is that the case?
No, it isn't. Secondhand smoke affects, it turns out secondhand smoke probably affects women even more than it does men.
Wow.
And certainly secondhand smoke has been implicated in lung cancer for both men and women.
Yeah.
So it's a real problem.
Michelle, you brought a little lung in with us today.
That's actually that's a pretty big one.
That is. Let's talk a little bit. I know you work firsthand with women going through lung cancer.
Yes.
Let's talk a little bit about the symptoms and what people can do to keep a heads up.
Well, sometimes there are no symptoms, so it's always very good to be aware of different types of screenings that are out there for patients. So if you are a smoker over the age of 55, you should have a low-dose screening CT scan. But some of the symptoms are coughing, new shortness of breath, unexplained weight loss, having sputum that's new, so things like that are changing. And if you have any of those symptoms, you should see your doctor.
I think a lot of people, when they get that diagnosis, they kind of feel like, oh my goodness, I'm in this corner, no one's there to help. That's why you guys have nurse navigators, of which you're one, where you're able to kind of help shepherd them through the process, right?
Correct. So once a patient is diagnosed, I receive their information from doctors, so I'm able to help educate them about their diagnosis. I can explain a little bit further than what their doctors are able to. Some of their concerns when they get diagnosed, sometimes they're so stunned that they don't realize what questions that they have. So, later, a few days later, they're like, how am I going to get to these appointments? How am I going to afford this? Who should I go see? So I am kind of their buddy during this type of treatment and their recommendations, and help them through their whole cancer diagnosis and process.
Yeah.
Oh, good for you.
Yes.
Dr. Hamilton, this really is a wake-up call to all the ladies watching out there, to go in and get that screening. Nevada actually has quite high rates for lung cancer. Why is that?
Well, the incidence of lung cancer in Nevada is actually in the lowest quartile nationwide. However, the mortality rate once a diagnosis is made is very high. And we think that's largely because the diagnosis is made very late in the game. These are people with very advanced disease for whom surgery and or chemotherapy and or radiation therapy just isn't going to get the job done. And lung cancer, for whatever reason, has been stigmatized. There's a lot of blame game that happens because of the cigarette smoking relationship.
Yeah.
And as a consequence, a lot of people will be reluctant to seek treatment, and when they do, as I mentioned, it's just unfortunately too late.
Yeah. So what are the treatment options when you're able to catch it? How many different options are there, frankly, for us?
Well, for lung cancer, like many other cancers, the treatment is becoming a multimodal approach. That is to say, surgery, chemotherapy, and radiation therapy, either alone or in combination. When a very early lung cancer is identified, a definitive operation can be curative in a large proportion of patients. That's why early diagnosis and treatment is so important.
How much does family history play into this as well?
Lung cancer is a little bit different than many other cancers. Although there's probably a genetic component that predisposes people, we don't see many lung cancers that are familial. That is to say, my grandfather had it, my father had it, I have it, unless these are all people who are heavy smokers and have this long-term smoking history.
Yeah.
Right.
We just don't think there's much of a hereditary component. This is what we call a sporadic cancer.
Not only is next week Women's Lung Health Week, next week is also National Nurses Week.
Yeah.
Yay.
This is your plug. This is your chance.
Wow.
So I always say the best thing I ever did in my life was become a nurse, and nurses care so much about patients. They work really hard, and it's a great week to celebrate them, and I'm sure everyone's life has been affected by a nurse, so make sure you go out and thank them.
Well, and I will say my life has been affected by nurses when my father was being treated for leukemia. It's just amazing to watch these women and men work 12-hour shifts, and they really are that human connection between the doctor and the patient. So bravo, all the nurses out there in Las Vegas. Let's celebrate you next week.
No question.
For sure.
Thank you so much for being here, and glad to have you back.
Thank
Doctor.
you.
Thank you
Yeah,
so
welcome
much.
back to Vegas, doctor.
Thanks so much.
All right, next week, Women's Heart Week, rather. There you go.
it.
Start that conversation with your doctor. Some patients may qualify for a free lung screening as well. That phone number right there on your screen. Same for the website. Sunrise Hospital and Medical Center is a proud sponsor of The Morning Blend.